Joining us now is Wyoming Senator John Barrasso. He is the chairman of the Senate Republican Conference and a medical doctor as well. Senator, good morning and welcome.
Good to be with you, Sandra.
So do you believe that a fourth stimulus bill will be?
Well, before getting to that, let me first say, as a doctor and a senator, I want to make sure that people are taken care of in terms of their health and their well-being. And this is going to be a critical and crucial week in America. So the more people can do to stay at home, to wash their hands frequently, to avoid touching their face, the better it's going to be. With regard to a fourth package, I did talk to both the president as well as Senator McConnell this week. First, we have to make sure that this last bill, the CARES Act, actually works to get relief to the people that need it, which is just about everybody in America, to make sure that the healthcare providers get what they need, and to make sure that our small businesses are able to get these loans. We put out about 17,000 loans already, about $5 billion, but there's $350 billion in this project. With regard to a fourth package, I believe that there will be one. But I have to tell you, Sandra, there is just no way that Nancy Pelosi can once again bring to that her list of liberal leftist approaches of the Green New Deal and election reform, things she's talking about diversity of corporate boards. This is a crisis that our country is facing. Anything in this fourth package has to make sure that we have fulfilled the needs that we promised would be met through the third package.
So it sounds like you agree with Mitch McConnell in this wait-and-see approach with the first three rounds of stimulus that was overwhelmingly bipartisan. So how do you keep the approach to relief for Americans bipartisan when clearly Nancy Pelosi is making the case for more stimulus and Mitch McConnell is saying, hold on, let's wait and see?
Well, we actually had that process in a very bipartisan way in the Senate before Nancy Pelosi came in with this big liberal wish list. And now she's trying it again with phase 4, where she wants tax breaks, as she said, for millionaires in the blue states. Well, that's not going to cut it either. If we do get to a phase 4 and you want to actually, and we're at a point where we're beyond this and we have the disease behind us and we need to stimulate the economy, one of the things we've been talking about is the highway bill, the infrastructure bill, things we need to do to help rebuild the country. I've talked with the president about that. We have a bill that's come out of the committee in the Senate that I chair. It's passed 21-0. Every Republican, every Democrat has voted for it. We ought to stick with the bipartisan things that work rather than the sort of things that Nancy Pelosi is trying to bring to the table to take the country in a direction that the American people say, let's deal with the crisis that is affecting us right now.
Well, Senator, you do come at this from such a unique perspective, also being a medical doctor as well as a U.S. Senator. Dr. Fauci over the weekend was warning against the dangers of those states who have not implemented complete stay-at-home orders. Wyoming is one of them. Here's Dr. Fauci.
The tension between federally mandated versus states' rights to do what they want is something I don't want to get into. But if you look at what's going on in this country, I just don't understand why we're not doing that. We really should be.
So is that something that should be considered for your state?
Well, you can always depend on the people of Wyoming to do the right thing. We do have a state of emergency in Wyoming. Anyone coming into our state, there's a 14-day quarantine. People are staying at home. But remember that people are spread out here. We only have about 5 people per square mile. We have been socially distancing the entire 130 years that we've been a state. We survive by people, helping neighbor. Right now we have 200 cases, no deaths, and we hope to keep it that way by continuing to do the right thing.
What's the risk or the harm in issuing that stay-at-home order statewide?
Well, people are staying at home in Wyoming, so it's being done already. I think the governor has struck the right balance, and this is the people of Wyoming know what's best in Wyoming. We're going to continue to do that. We're going to continue to follow all of the recommendations that are there. In Wyoming, people are really staying home. I mean, if you go to the grocery store, people are wearing masks, keeping distances. There are special hours set up for seniors. But it is a state where neighbors help neighbors, and we're going to continue to do it that way.
That sign of unity is something that we can all come to appreciate during this difficult time for our country. Senator, really appreciate you coming on the program this morning. Great to see you.
Thank you, Sandra.